In order to look at this question, we need to look at two main implant characteristics. First is the intraosseous part with an intelligent screw design that enables an optimal surgical positioning and a good primary stability. The implant design and the screw design may not be too aggressive though, in order that a failing implant can be removed without collateral damage. Second, there's a cervical part with the connection to the prosthodontics. A small machined collar portion removes the transition area slightly away from the bone, leaving the marginal mucosa and the bone itself undisturbed and therefore healthy looking. And still, the crown margin is located submucosally and therefore invisible. And last but not least, it's the unique connection to the crown with the stabilization ring, which is extremely precise and results in a record small screw access hole. All in all, I think the Thommen Medical implant combines all these features to an optimum for today's clinical needs.